Hola, buenos días. Mi nombre es Dr. Gombele. Amigo, ¿cómo estás? Bonjour, comment ça va? Je m'appelle Dr. Gombele. Hi, my friend, how are you doing today? My name is Dr. Gombele. Mwana mboka sango bone. Il faut s'abonner, hein? Tiens, va commentaire na ona sekuna. Hein? Il faut aider biso. So, excretion, how metformin comes out of the body. It comes out of the body via urine. You go to pee and it comes out. But are there contraindications taking metformin? I mean, are there circumstances, medical conditions that we will not allow our patient to take metformin? Yes, right? My review says that people with heart failure are not supposed to take metformin. Heart failure, right? And then, of course, if you have had allergic reaction to metformin, so you are not to take. You took metformin one time and you start having rashes and diarrhea and vomiting and then headache and the eyes became red and the heaviness of the tongue, numbness of the lips, right? Rash. So you note that and you go to the doctor, you tell the doctor, I took metformin and this is how I reacted. Then you have allergic reaction to metformin and then we will not give you metformin again. And then people also with severe renal disease, right? They are not supposed to take metformin. And of course, people with diabetic ketoacidosis, it's just a medical condition that diabetes patient can develop if they don't take the medication properly. They are not to take the metformin during that medical condition. Metformin and alcohol are enemies, right? So you cannot be taking metformin and drinking alcohol. No, because alcohol will drop low the sugar and metformin can do that. So we cannot combine both alcohol and medication. And if you're listening to me, you take alcohol, stop taking alcohol and continue taking metformin. So metformin, great, good medication, but it also interacts with many other medications. What do I mean by that? That you may have medications that you take and strengthen the efficacy of metformin. That means if you take this medication and you take metformin, it may further bring the sugar lower, right? That's how medication interact with others, all right? You can also have medications that you take and decreases the strength, decreases the medication that you take, but decreases the efficacy of metformin. That means when you take the medication, metformin, it doesn't really help much, so you have to take plenty. We need to know those. You leave that to us. We need to know so that we see what's happening. You're on metformin and the condition not being controlled, so we start seeing what other medication. I tell you what, there are almost 352 according to drugs.com, which is a website where people who take drugs report, right? According to drugs.com, there are 352 medications that interact with metformin. So I suggest that we doctors, we will be studying. That's why you go to your doctor and he will ask you, do you take any other medication? What are those medications? When we take the history, right? Do you take any other medication so that we can see if the medication that you are taking helping or not helping or interacting with other medication. That is the doctor's job, not yours. Your job is just take the medication as prescribed by the doctor and advised by the pharmacist. So we are going to pause and then we come back to talk about a very, very, very important section in our presentation. side effect. Okay? So again, I'm going to invite you to do what? To subscribe, to like, to share. We are running now, we are 869. We just have less than 130 or 131 to hit our goal. It has been a long journey from last year, but we thank you very much for your view. We thank you very much for your comment, and we thank you very much for your subscription. And we look forward that you can subscribe more, so that we can hit the 1,000 goal. But our main goal really is to educate, and we have been doing that for 1 year now. And we have more content. And now we embark in another content where we will be discussing with you medications that you use to control your diabetes. Side effect of metformin. Metformin is a drug. And as any other drug, they are side effects. Even Tylenol, Panadol, or acetaminophen. In this country, in the Caribbean, it's out over the counter. You just go and then you buy and then you take. But I was talking to a Japanese friend of mine, and he told me that in Japan, when people have headache, they go and drink water or they go and rest. But here, when we have headache, we run into what? Medication. And when we take too much of medication, definitely we are going to have side effect. And the side effect of metformin, I'm going to start by the less common. That means we don't really see that as much as possible. Common, that's what we see, and more common. And then I went to this website that I will advise you to visit, drugs.com, because the side effects from that website are not always the side effects reported by the pharmaceutical company. That website, drugs.com, catalog or list the side effect that patients call in and tell them, all right? And most of them are pharmacies, so they know already what to expect, because the interest, the conflict of interest may play here, right? In fact, in each box that you buy, you should have a paper indicating to you all the side effects of the medication that you, the patient, should know. But if I open some of these boxes, oh, this one has, right? But other boxes do not have, right? Now, the boxes that do not have, that means they keep you ignorant of the side effects of the drug that you are taking. What are the more common side effects of metformin? Belching, right? People say, oh, doc, when I take metformin, I belch a lot. Bloated. The abdomen become bloated. Heartburn, right? Indigestion, right? You eat food, but you feel like the food not settling in the abdomen. You have some kind of heaviness around the stomach. That is called indigestion. And then sometimes people have loss of appetite, right? So when I take metformin, I don't feel like eating. And then the other more common side effect that people have, the metallic taste. Metallic taste in the mouth, right? So you know, as a doctor, you just advise people that no man, just keep on taking. And as we continue taking, most of those more common side effects subside. Belching, bloated, heartburn, indigestion, loss of appetite, and metallic taste in the mouth. These are the more common side effects of the medication. And then we will not stop giving you metformin because of these side effects. Because more your body gets used to the medication, the side effect will subside, all right? So more common side effect, of course, metformin can lead to lower blood sugar, right? Nausea, right? Diarrhea, cough or hoarseness, all right? Decreased appetite, as mentioned earlier, and muscle pain, cramping pain in the muscle, right? These are the side effects of metformin, right? Generally not feeling well, right? And then sleepiness, you want to sleep. These are some of the side effects of metformin. This is a common one, not more common, but a common one. Now, we have some less common. Less common, I mean, maybe 100 people, maybe 5 or 2 can present with the side effect, but guess what? You can be that one, or you can be that among the 5, right? So less common side effect, anxiety, right? Anxiety, blurred vision, chest discomfort, right? Cold sweat, right? Confusion. Yeah, metformin can lead to confusion, right? Swelling in the joint. Now, these are the side effects that I personally discontinue the treatment, right? Anxiety, and most of diabetic patients are in the 40s or 50s, and then they are female, and they are going through peri or menopause, right? And that also brings some kind of anxiety. And now you take a medication that also brings anxiety. So here and then I will have to stop. Chest pain, we don't want that, right? And cold sweat because maybe the sugar is going down. And confusion, you don't want that. People drive and people mind their business, talking or cashing or, you know, confusion is just not something that you say, okay, it will go away. So if I hear the side effects of metformin, confusion, I will stop giving the medication. Now, there is one here that's very rare, right? Very rare, right? Among the less common is what? Depression, right? Depression, problem breathing, right? Heart racing, right? Headaches, right? And seizures. Now, these are not from the pharmaceutical company though. These are from the drugs.com, how people report, right? Now, but you, that one's in a million, but you know, we will watch, we will see what's happening. You know, you never had seizure before. You diagnose and start on metformin, you develop seizure, we stop metformin, full stop, right? We stop metformin. And there is one very, very, very rare low blood count, right? Because metformin affects the vitamin B12, and that also contributes to the formation of the blood. So like 0.2, 0.3% of all the people who call into drugs.com report that low blood count. But this is not really anything to worry about, because if you keep your appointment to your doctor, you go every 3 months or every 6 months, and once in a while, the doctor will do some blood check, and CBC, complete blood count, is among the routine blood count that we do, right? And then we will see that the blood count is within the normal range so that we can continue giving the medication. So in conclusion, what we have to say about metformin. One, is the first medication of choice, right? In the treatment of type 1, no, type 2 diabetes. And sometimes people also give it to treat gestational diabetes, but they don't like, because we don't know the outcome. Studies have not really, we have not done many studies to see what it will be. That's why we switch quickly to insulin. But it is tolerable, depending on the side effect. Most subside. The rare side effects may not happen with you, right? And everybody is different. You may have metallic taste, I may have rash, you may have nausea, and you may have nothing, right? So it is a good medication. When you're on metformin, keep your appointment to your doctor, all right? So that the doctor will be questioning and then looking if you have any side effect, right? Metformin is an excellent medication in the management of diabetes mellitus type 2, along with diet, exercise, and education, right? So it is not only medication. We are not saying take your medication and eat everything that's suicidal. Take your medication, follow some kind of diet, do exercise, and be educated. And then you will control your medical condition. Within this case we are talking is type 2 diabetes. All the best. Remember to like, share, subscribe, and what? Click the notification bell so that when we upload our very next video, you will be notified. Au revoir. Hasta luego. Bye bye. Ngamo. Dokotolo. Munganga. Dr. Gombele. Hasta pronto. Bye bye.